Outpatient Medicine Clinic. This is Dr. Smith. How may I help you?
This is Dr. Jones from hepatobiliary surgery. I need you to medically clear a patient for surgery on Monday.
Okay, can you tell me about the patient?
He is a 64-year-old man who needs an operation on Monday. Can you clear him for surgery?
Okay, I need a bit more information. Does he have a cardiac history? Diabetes? COPD? Any other medical problems? Is he on any medications?
Mr. Alpha is a 64-year-old man with a history of diabetes, seizure disorder, myocardial infarction 3 weeks ago with an asystolic cardiac arrest, implantable defibrillator, on hemodialysis with a 2 cm peripheral hepatocellular carcinoma. He is on 12 medications, which are listed in the computer. He is your patient, and I need you to clear him for surgery on Monday.
Okay, the computer shows that the last time I saw him was a year ago, because he has been in the hospital 8 times and missed every appointment. Today is Friday, and I can't clear him for surgery on Monday without seeing him. I am very overbooked today. I will see him on Monday, but he will also need a stress test, and I will need to speak with his cardiologist and neurologist.
You are his doctor. You must clear him for surgery on Monday so I can resect his tumor. You also need to stop his aspirin and Coumadin so he does not bleed during surgery.
If the surgery is on Monday, it must be an elective surgery. I can clear him for surgery by Wednesday if his stress test is okay and his cardiologist and neurologist agree. Then his nephrologist will need to make sure he gets dialysis the day before surgery. Also, he needs his anticoagulation for his cardiac stent. He will need to be on Fragmin, which will take a week to get insurance approval for. I'm sorry, but that is the best I can do on such short notice.
This is ridiculous. If you do not clear him for surgery on Monday, I will lose the OR time for the entire day.
Now just wait a minute, Dr. Jones. Your last-minute planning is not helping my patient. If you would have called me yesterday, I could have done all this today. You will just have to reschedule the surgery.
Dr. Smith, I am trying to save your patient's life, and you are not helping at all. You have no idea. I have cases booked for the next month. I did you a favor by fitting Mr. Alpha in for surgery when I had a cancellation today. Anesthesia will not give me an extra room for a month, so this is the only time I can operate on Mr. Alpha.
Dr. Jones, 1 second please. That is the intensive care unit paging me. Mr. Alpha has just been admitted with abdominal pain. He has iron in his biliary tree and an inflamed gallbladder. I will call the inpatient medicine team to clear him for emergency surgery immediately.
That changes everything. Since he is septic, I will not be able to take Mr. Alpha to the OR until his infection has cleared.
I don't understand. He has pneumobilia. It is a surgical emergency. He will not clear his infection until you take out his gallbladder, which is obstructed by his tumor. You need to take him to the OR tonight or he will die.
What don't you understand about sepsis, Dr. Jones? He is much too sick to take to the OR now. If he codes on the table, it will go on my statistics. He is going to die anyway, and there is nothing I can do about it.
But the reason he is sick is that he needs surgery. You will save his life, and you can take out the hepatocellular carcinoma at the same time. There's no other hepatobiliary surgeon in the hospital who could do such a complex case. It is Mr. Alpha's only chance.
Okay, I will try to save his life. My surgical fellow just paged me. He saw Mr. Alpha and has booked the case as an emergency. Mr. Alpha is in intensive care now, just finishing dialysis. This is good. Anesthesia will have to give me the room now.
Thank you, Dr. Jones. I know that Mr. Alpha is high risk and I appreciate your caring for him.
Of course. Thank you for the consultation. I need to get to the OR now. But one more thing.
Yes?
I need you to clear Mrs. Gamma for a cholecystectomy on Monday. She is a 30-year-old woman with no past medical history. She is not on any medications. You referred her to me 2 weeks ago. I can move her into Mr. Alpha's OR slot on Monday. That will keep vascular surgery from taking my OR time.
Of course. Mrs. Gamma has no issues except for her gallstones. I saw her 2 weeks ago. I will put a note in her chart and fax it to your office right now.
Thank you. I need to go to the OR now. Otherwise, anesthesia may delay my case for an elective hernia repair.
Okay, thanks for taking care of Mr. Alpha and Mrs. Gamma.